we make sure that we have a predefined criteria, and we have a research question that we are trying to answer, and that research question is answerable. It's basically not vague, it's very clear, and I will show you how you're going to design your research question for a systematic review in a minute. But overall, systematic review is a very rigorous form of research where you indulge in a step by step method of conducting a thorough, comprehensive review of all the research, all the primary research on a particular given topic, and you try to filter out the studies and get the highest quality of evidence in one place, and then try to answer that one question that you started off with, right? So before we even understand the different types of research review articles, I would like you guys to just take a moment here and see this pyramid. I'm sure that many of you already have seen this pyramid, but appreciate this pyramid a little bit. Like, let's go into the detail. Like, from the base of the pyramid, you can see that we have the weakest form of evidence. Why? Because the weakest form, by weakest form I mean that they cannot be generalized to a larger population. That is what I mean by weakest, right? They cannot be generalized. If there's one case report of a certain topic on a certain topic and it's beautifully written, it's published in Lancet, but it's a case report and it's still considered to be a weakest evidence because it's just one person. Same goes with the opinion papers, same goes with the letters. They are the expert opinion of a person who has been in has been working all his life, but it's still an opinion, right? It's and in science, in basically research, opinions do not hold these the um, most I don't know what to say this, like they do not hold the most importance when it comes to evidence building, right? So it cannot, an opinion paper or a letter to editor will not change the course of the clinical practice. That's what I mean, right? It can change the perspective of a few community scientific community members, but it will not lead to a change in the clinical practice. What will lead to the change in clinical practice is the highest form of evidence. When you go up the evidence pyramid, you can see that the different types of studies start to show up, and as you go up the pyramid, you see the strength is increasing in size, and because the reason is that now we are moving towards a more unbiased form of research, and also we are trying to make sure that the methods that we are using in our research is becoming more rigorous and more more stronger and very vigilant of how we recruit the patients, what is the sample size, how long do we follow the patients. I'm sure that you all are aware of what cross-sectional study is and what a case control study and what is a cohort study is. Am I right? Are you guys clear on that? Is there anyone who does not know the difference between? Acha, if you guys are writing in chat box, I cannot read them right now because I have my presentation open. So Abdullah, if you can help me out with that, that would be great. Thank you.
Ma'am, actually, many of the students who have joined us are from first years. So, if you can briefly summarize the differences, it will be very helpful because many people are asking this question.
Yeah, that's totally fine. Don't worry about that. So let me just start off with a cross-sectional study. And you always, whenever you read a word, you need to go back to the vocabulary, like go back to what it could mean. Cross-section in biology means like a section of a specimen, right? A section of a specimen. Now imagine you have the whole population, and then you cut them in the middle, and then you take that piece of population, and then you observe it under a microscope, right? That is a cross sectional study. And in literal meaning, this word cross sectional means a section, right? A snap or a piece of a specimen. So in a cross sectional study, what you're doing is you are trying to take a snapshot of the population at that particular point. So if I'm doing a cross sectional study on for example depression, so the way to go about it is that I will have a questionnaire in my hand, and I will have my target population, and then I will give them the questionnaire. They will fill it out, and then I'll take it back, and then I'll just post my results. That is a cross-sectional study. I went in particular on a particular day to the target population. I took the data from them, and then I came back and I analyzed the results. That is a cross section, because I went one time, once in a specific time, right? There's no going back. I did not contact the participants back. I did not follow them. I did not follow them retrospectively or prospectively, right? So I just went and took a snapshot, and then I came back. At that point, the depression was XYZ. I can say that. I don't know what it was 10 years ago. I don't know what it will be in next 10 years, because I'm not going to follow them. It's going to be just like for now, it is this. Do you understand? Now, when we talk about the cohort study, I'll come back to the case control soon. But study is different than cross-sectional, because in cohort study, we are actually making a making sure that we follow the patient for a certain period of time. We start from time A, and then we go further 5 years, 6 years to time B. And then during that time, we collect the data from the same community. I went to the target population, I took the data at time A, and then I came back again. I came back at every 6 months, and then I took the same data over and over again. I am now following them actively, and that is what a cohort study is. Now, you see, this will be actually more strong in nature, because now I'm following the patients. I'm now seeing the effect of different things on their lives. Maybe today I'm not depressed, but tomorrow, if something happens and my mood goes down, I will be depressed. If I have a bad breakup, I will have depression, right? So I'm being followed now. For the next 10 years, someone will be following me throughout my life, and they will come and see whether I've developed depression or not. Similarly, if you talk about exposure, if you talk about lung cancer studies, what they do is that at time A, nobody has cancer. Everybody is healthy, but they are smoking, for example. So what I'm going to do as a researcher, I'm going to follow them for a certain period of time and to see whether they develop cancer or not. That is a cohort study, right? Now, when you talk about the case control study, by case control, I means now you have a control group. Now you have one group that has the disease, that is case. The other group does not have the disease, they're healthy. Now you have two groups of people, and now you're gonna follow them. You're gonna see whether they have different exposure. You're gonna observe the different risk factors in these groups to see whether one group had a certain specific risk factor because of which they developed the disease, and the healthy group will be the comparison group. So an example of that would be, you have a group of lung cancer patients, and the other group is not having lung cancer. It's healthy people. What you do is you see whether they smoke, whether they, both of the groups, whether they have some specific dietary patterns. Do they go out in do they work in a polluted environment? Is there anything else that could have caused could have contributed to development of their cancer, right? And you're gonna find observe these risk factors in both of these groups, in the case group as well, and in the control group as well. And then you're gonna compare, and then you're gonna realize that certain risk factors were more frequently found in the patients with lung cancer. That's an hypothetical example. I'm not saying that it's true for every research, but what I'm trying to explain is that in case control study, you have two groups. You have the patients with disease, and the other group is does not have the disease. And what the researcher is trying to do, they're trying to see whether there's any specific risk factor which is more prevalent in the diseased group as compared to the control group. Understood? Is that clear? Now you know the difference between cross-sectional, case control, and cohort. Okay. Do we have any questions, Abdullah?
Ma'am, right now there are no questions in the chat box, but someone has raised their hand. Bushra Ahmed, if you have any questions, you can unmute yourself and ask.
Yeah, please.
Ma'am, I guess it was a mistake at their end.
Okay, if anyone has any question during any time, you can always, write them in the chat box. Okay, I'm moving on. Now, coming towards further, now you see how the different researches have less bias, some has more bias, and some are more rigorous than the others. So as we move up the pyramid, you can realize that that we are getting stronger in terms of now, when you come to the second highest form of evidence, we have the randomized controlled trials. Now, randomized controlled trials are a beautiful type of study, and why I say that is because they have the least. They are basically the primary study, and also because we have less bias in this type of study, less bias because we are randomizing. We don't know what group will go where. We don't know that because we are going to be blinded. The other person will be blinded. We don't know whether the person will have the intervention or will they have the placebo. Now I'll explain it shortly what it is. Randomized controlled trial means that you have an intervention that you want to check whether it's effective or not. Intervention could be pharmacological, it could be non-pharmacological, it could be a medicine, it could be a strategy. So for example, let's say I want to see whether drug A is better than the drug B. Let's say that's the question, right? Now, the drug A is the new drug, and drug B is the standard drug. And what I'm going to do is I'm going to have plan a randomized control trial for my patients. What I'm going to do is that whoever comes to my clinic, I will either recruit them in the intervention group, that will receive the drug A, and the other person will receive the drug B, which is the standard, that will become my control group. And then I will compare both of these groups and see which drug is more effective. Now, I will do one more thing. I will make sure that I'm randomizing my recruitment of patients. By randomizing, I mean that I will make sure that the patient does not know whether he is receiving the intervention, drug A, sorry, or the standard drug, that is drug B. So he does not know that. He does not know that. He is not aware of that. And I am also not aware of that because I blinded myself as well. I made sure that I don't know as a researcher whether I am giving him the drug A or drug B. And I know it sounds complicated because how would you conduct a research without actually knowing which drug you're giving? But there's a whole team of members, whole team of scientists who are you know managing these randomized control trial. And some of the people, the main person who will do the analysis will remain blinded. The main principal investigator might know which drug is being given to what patient, but the patient and the scientist who will be conducting the analysis will remain blinded. He will not know whether the analysis that I'm doing is for drug A or drug B. So that is called a double blinded randomized control trial. Now, you could have a single blinded randomized control trial as well, where only the patient is blinded and not the researcher. But it's best practice to make sure that both the scientist who is conducted the analysis and the patient are both blinded, right? Now, that's the highest form of research you can do. And then comes the even more stronger form of evidence, and that is a meta-analysis or a systematic review. Now, they sit at top of the pyramid. They enjoy that position because of certain reason. And I will just quickly show you with an example why is that. Okay, so let's say you have, as I said, that you have a drug A, which is, new, and then you have the old drug that is drug B. Now, in Pakistan, one randomized control trial conducted, for example, hypothetical, and that actually revealed that drug A is, slightly better than the drug B, for example. And in India, another study, RCT, was conducted where the drug A was not significantly better than drug B. They did not see any difference between the two drugs. And in the US, they also conducted the same trial, but they found out that drug A is significantly better than drug B. But in UK, the inverse findings were revealed. That is, drug B is better than drug A. Now, as a doctor practicing medicine, are you confused which drug to give to your patient? Do you think you will make the right decision for your patient based on this result? Based on the four different types of RCTs, each of them showing a different sort of result. No one of these RCTs are agreeing with the other. Now, at this point, what do you think the scientist would do? Sorry, the doctor who is, practicing medicine, and he wants to see whether I can give the patient drug A because drug B in is the old drug and drug A is the new one, and I want to see whether drug A is better for my patient or not. Now, the doctor has, two options. He can conduct his own RCT in his little clinic, or he can find a meta-analysis or a systematic review that is conducted on these RCTs, that has combined the data from all of these RCTs, pooled them, and answered your question whether drug A is better than drug B. Now, when a meta analysis will say that drug A is better than drug B, that is your definitive answer to that question, and you can, without any haste, prescribe your patient drug A. Do you guys understand the significance of this pyramid and why we do meta analysis and why we do systematic reviews? Do you all understand now? Because it has direct impact on the clinical practice and the policies that we have. Do we have any questions at this point, or are we all clear?
Ma'am, there are no questions in the chat box right now.
Okay, thank you, Vidal. So let's talk about narrative reviews and how you're gonna differentiate them from systematic review, right? So, and everybody knows what narrative reviews are, right? Now, narrative reviews are basically a very broad sort of research where we actually comprehensively summarize the evidence that's published, but we don't follow any systematic methodology. The methodology that we follow is more descriptive in nature. We just find out, we just narrow down our topic that we want to work on. It's not a research question, it's just like a narrative review is basically, you want to summarize a topic, a specific topic, and you just want to make sure that the current evidence is in one place, right? So it's like a chapter in your book. Perhaps there's some debate going on a topic, and you just want to make sure that all the evidence is there, and you're trying to see what the current research is saying. It's like it's more descriptive, more narrative in nature, and it's like a chapter in your book, right? So in contrast, when we talk about the systematic review, we must have a predefined protocol and research question in place. We cannot just go ahead and just start off with your systematic review unless and until you have a research question, unless and until you have a predefined protocol. And protocol is basically the plan of your research that you're gonna take. And without predefined protocol, without predefined research question, you cannot conduct a systematic review. Also, that your research question needs to be answerable. It needs to be so clear that that anyone from the scientific community will be able to see what you are trying to do. In narrative review, it could have a broader scope. It could be vague in nature. It could have a lot of things going on. But when it comes to systematic review, it needs to be very specific, very pinpoint, and it needs to be very answerable. Like it needs to be something that you can answer in terms of your evidence, in terms of your existing evidence of literature primary researches, right? You will understand it in a bit. Now, systematic review, why do we need to make it so, difficult and so rigorous and so complex? Is because they actually help you in developing policies. It also helps you change in clinical practice, and systematic reviews recently has been shown to do that. And this extract is from a research paper that I have placed here, and it is very important part of our clinical and non-clinical healthcare system, right? Because they are basically what systematic reviews does is basically they answer your question, right? They answer a specific question, whether this vaccine is better than that vaccine, whether which vaccine should we use, which treatment should we use for certain diseases, whether there's for certain diseases, whether there's any other types of treatment that we can use. So these are the specific questions that the systematic review and meta-analysis are trying to answer. It's very specific. But in contrast to that, narrative reviews could be a summary of a specific topic, like different treatment modalities of chondrosarcoma, for example. Now, this is not answering any questions. This is just stating the different types of treatment modalities. It's not going to tell you which one is better than the other, but it will tell you what are the different modalities of treatment. Do you get it? Okay. Now, what is a meta-analysis? Now, to understand this, just see that you have different RCTs. As I said, that you have a RCT from Nepal, you have a RCT from Pakistan, you have a RCT from Bangladesh. And what you're gonna do is in a meta-analysis, you're gonna have to combine all the studies together, and then you're going to extract the quantitative data, the basic effects estimates, like for example odds ratio, relative risk, frequency. These are the quantitative data that you're going to extract, and then you're going to combine them, pool them, right? It's using a statistical software. So to understand a meta-analysis, it's important to understand one thing. Without, now be very attentive when I say this, without a systematic review, you cannot conduct a meta analysis. Without conducting a systematic review first, you cannot conduct a meta analysis, because meta analysis is a subset of systematic review. What we are trying to do in a systematic review is we are going to use a set of criteria to include certain studies in our systematic review. We are going to answer that question. We are going to summarize everything together to see what the different studies are saying about that question. And then once we are sure of that, then we are going to extract the quantitative data and then go a step further, use the statistical software like REF or RevMan, Stata, and use that to combine the quantitative data and then give the pooled estimate or the average score from all of those studies that we used, right? So it's easier to understand it as part of a systematic review when you just go one step further, use a statistical software to combine the study results from different multiple studies. All right. Any questions so far? So now you should be clear on what a narrative review is. It's more descriptive in nature. It has a broader scope. It does not follow any predefined methodology, and it will not be as rigorous as the other types of review. Systematic review is a rigorous type of research where you use a predefined research question to answer something, and you use a methodology, you use a protocol, and then you register it as well before even conducting, right? Then meta-analysis goes one step further than systematic review, and it pulls everything together in one pooled estimate, and that is going to be a quantitative data, right? It's going to combine the quantitative data, basically the number, numericals, the risk ratio, the odds ratio, the frequency, prevalence, incidence, things like that, and it's going to combine everything and it's going to give an average score. Here I've given you an example. Imagine pooling together the scores from multiple soccer games to find the average score. So that is exactly what a meta-analysis does, is gives you the average score from all of the studies combined. So moving on to the next topic, we have how to develop a research question for a systematic review, right? So we will be using, as I said, the systematic reviews are basically, they have a very clear and very explicit question that they're trying to answer, right? So how do you do that, how to actually do that, is you can do that by following the prisma guidelines, that it should have an explicit statement, and that the question should be based on the pico criteria. We will go into the detail of pico criteria in a minute, but first I would like you to understand what a prisma guideline is. So every research is supposed to be conducted based on certain criteria, right? Mostly, like then for reviews usually we use the prisma guideline, because there are set of guidelines that we need to follow, and it just helps us make sure that we are not missing out on anything. It's basically a checklist where you tick mark everything that you have done in your review so far, and it will be mandatory for you guys to submit it along with your manuscript when you are submitting your systematic review or meta-analysis in a journal. So most journals actually ask for a prisma checklist, whether you have tick marked everything that's supposed to be in a systematic review. And what's supposed to be in a systematic review, you need to have, starting from the abstract, you need to have a clear title, right? Title should be very clear based on the research question. It should have a clear title, like who is your population, what is your intervention that you're comparing, what is the outcome that you're assessing, and then the abstract should come, and then the main introduction, main research question, and then the methodology that you have used, the inclusion exclusion criteria, the search string that you have used. So these are the things that you need to not miss out on. So that's why we have the prisma guidelines, which makes it easier for you to follow a very systematic way of conducting a systematic review. You all can go on, check www.prisma.com, and you will find a lot of prisma guidelines for systematic reviews, for systematic review and meta-analysis, for scoping review, right? Scoping review is also an advanced technique that we use for a study that has a very broad research question. So we'll not go into the detail of that, but for now just know that prisma guideline is used by all the researchers who are involved in conducting systematic reviews and meta-analysis. Now, what does the Prisma guidelines say about developing a research question? It asks you to have a very clear statement of what your review will be addressing, and you need to use the PICO criteria. And what is the PICO criteria? PICO is an acronym that is defined by the population that you are working on, the intervention that you are exploring, any comparator group that you might have, like a placebo group or the standard intervention that you usually give, right? And then you have the outcome. At least one single outcome needs to be there, without as listing down what you're trying to assess, what the intervention is gonna do, whether it's going to reduce the pain levels, whether it's going to treat something. So you need to define the outcome very clearly, and it cannot be ambiguous. It cannot be something abstract, something that you cannot measure. So it needs to be measurable as well, right? So You're gonna now apply this in the next example as well. Let's see. So this is a hypothetical research question. Here it says the example of the research question is that in adults with chronic low back pain, how effective is yoga compared to standard physiotherapy exercises in reducing pain intensity? Now I want you guys to take a minute or two and categorize this question based on the PICO. And I will ask one person that Abdullah will highlight for me, and that person will have to come up with the PICO based on this question, right? Now, I'll give you 1 to 2 minutes for this. It's pretty easy. It's not something very difficult. Yeah. Okay. Abdullah, please highlight someone for me randomly.
Ma'am, Ishan Ahmed, are you there? Can you answer this question?
I could try.
Yeah. Go on.
So, based on the guidelines, the population would be adults with chronic low back pain. Then the intervention would be yoga or standard physiotherapy exercises, and you're comparing those two. So, comparison ही उनका होगा, and then the outcome would be reducing pain intensity. I think so.
Okay. Thank you. What was Ishan? Ishan, thank you so much. Abdullah, just highlight one more person for me, please.
Uh, Roma Shah, please can you answer this question?
I don't think my answer is any different from Ishan's. The population would be adults with chronic low back pain, and
Hmm.
intervention would be yoga and
Mm-hmm.
physiotherapy, which we'll be comparing it with, and the outcome will be reduced pain intensity.
Okay. Thank you so much. So that's exactly what it is. You guys did wonderfully. PICO's criteria means that you have to define the population. And what the population is that it's not just adults, it's adults with chronic low back pain. And when you talk about the intervention, it's yoga. The intervention that you're trying to see is yoga, whether it's effective or not. And you're comparing it with the comparator would be the standard physiotherapy exercises. And the outcome would be the pain intensity. That's what you're trying to see, whether there's any change in pain intensity when you compare yoga with standard physiotherapy. Now, I have an assignment for you guys, which I will give you at the end of this course. But I think let's continue. At this point, I think we don't have any questions, do we? It's clear, right?
Ma'am, Ira Javed has raised her hand. Ira, could you unmute?
Yeah, Assalamu alaikum. I had a question.
Walaikum.
When we're talking
Yeah.
about population, we just said adults, right? We didn't really say females or males, and we didn't specify that. And the same goes for chronic back pain. We haven't said कि कितने साल से हो रहा है. So do these factors not create a bias then in comparison?
Okay, thank you so much for the question. When we said population, we said that adults with chronic low back pain. Now, chronic by definition means more than 6 months, right? Chronic by definition means more than 6 months. So that's defined, that's clear. When we talk about the adults, we don't want to rule someone out, right? We want both the genders. This is not a gender specific question. If it was a gender specific question, For example, if we are talking about female and anatomy, if we are talking about something that is only specific to females, then we would not include males. Then we would not say adults, we would say female adults, right? So if it's not a specific to a gender, then why would we specify that? We want both the male and female, right? Does that make sense? Why
Yes,
would it
got
create?
it.
Yeah, it would not create a bias unless and until we are, specifically ruling someone in and specifically ruling someone out. It will only make sure that the both the population that we need to treat are there. If it were just like something related to males or females, then we would have to, obviously specify that we are talking about male adults and not female adults, right? And chronic by definition means less than more than 6 months specifically. But if you want to further refine it, you can do that as well. But right now it was more than clear enough. But one thing that I would suggest is that when you're doing your in class assignment, you should try to focus the population on focus your population on adults and with specific disease or disability, and then see whether which intervention will be better, right? And you can even further refine it by specifying the type of intervention that they are being given. There are different types of standard physiotherapy exercises, so maybe refine it further, right? But this is like a pretty clear, pretty obvious sort of question at this point, and this will definitely answer your question of whether which intervention is better than the other. Okay. Okay.
Ma'am, there's another question. If you allow, we can take it right now or at the end.
Yeah, sure, go ahead.
Okay, Junaid Hassan, you have raised your hand. You can ask the question.
Right. Thank you. So my question is related to the subject statement as well. So when you say the adult bracket, right, and of course we're putting a subset of chronic back pain, but for the adult bracket, do we include all brackets, which is young adults, adults, middle age, and old age? Right.
Yeah,
Okay. So that's
more than 18.
okay. A part of the question, right? Second part of the question is for such a generic search or mesh term, do we have to do the scope search for this particular statement? Because it's involving adults, and I'm sure there are a lot of researchers on physiotherapy interventions, but then they will have individual brackets for age.
Yeah, you can do that, but obviously at this point, I don't want you to focus on the search string, because this is a hypothetical question, right? When you start off your research, you may have to redefine your question as you go ahead, right? So this was just for practice, right? This was just a hypothetical question. But if you're talking about your scope research and your strings and your search strategy, you need to base that on the picos as well. If the population has different brackets, you will have to add that. You will make a whole row of what do you call that, row of different concepts. You will start off with your population, and as you said, they may be young adults, there may be middle age or whatever. You can add those brackets, you can add those things, and then you can add the intervention, different types of intervention. Yoga could be called something else, I'm just saying that hypothetically. And then the standard physiotherapy could have a number of synonyms, right? So you will have to make a table of all of these words, and then you will have to use that to build your search strategy. So definitely you will have to be as thorough as possible. And when you apply those filters in your databases, in your different databases, then you can see the kind of results you're getting and whether you're satisfied or not, or whether you need to further refine your question. Perhaps maybe you're getting a lot of researches and you're not able to narrow it down further. So maybe there's something wrong with the research question that you're posing. So sometimes what we do is we come up with a research question, we do our preliminary search, we see what the other researchers have used in terms of terminology, and then we refine our research question further. Maybe instead of yoga, we would have something more defined, more specific, as a, even a category of yoga type, right? And then we have standard physiotherapy, so there could be different types of exercises as well, right? So maybe you do your preliminary search first, and then you see whether you can, further refine it as well. Does
Right.
this answer your question?
Yes, absolutely. Thank you.
No problem. Okay, now selecting, let's go on. And if you have any questions, you can just write it in your chat box, and then we'll take it at the end, right? We are actually way out of time, but it's okay. We can extend it to 30 more minutes, right, Abdullah?
Yes, ma'am.
Okay, perfect. So the next topic that we're going to do is we're going to select the appropriate databases for literature search. Now, everyone knows what Google Scholar is, but let me just tell you, this is that Google Scholar is not a database. It's not considered a database. And can someone just tell me why is that? Why is Google Scholar not a database? Okay. So why do we say that Google Scholar is not a database? Is because it works like Chrome. It works like a search engine. It will when you search on Google Scholar, you will realize that it's not giving you the journal itself, it's actually giving you the link to that particular database. So it will give you the different journals as well, but it will also give you the databases, such as links to PubMed, links to Cochrane, links to Scopus, links to Elsevier. Different databases will be in its repository. So it's not specific to a journal. It's not going to index this journals itself. It's going to index the entire database itself. So it's more general and more broad, and it's gonna give you a lot of journals which are not even PubMed index. Some journals are not even relevant, and it's going to work exactly like what Google does. When you type something, it will give you everything at the same time, right? So it's harder for you to refine and filter out in Google Scholar, and it's not a database because it will have links to that different databases, right? It will give you PubMed, it will give Web of Science, it will just take you there, and then in that database you can find the different journals, right? So Google Scholar is not a database, it's a search engine, which is a good source of literature review, but it is not a very rigorous way to do your systematic reviews. So for your systematic reviews, if you're new to systematic reviews, I would really prefer if you just stick to PubMed. And before you even do that, you should check your review in Cochrane library. Now, Cochrane library is interesting because it's specific to the review articles. So whenever you're coming up with an idea, whether you're coming up with a research question, you should always check Cochrane library whether there's already been a published particular topic on that or not. मतलब अगर कोई ऑलरेडी सिस्टमैटिक रिव्यू पब्लिश हो चुका है तो हम दोबारा उस पर मेहनत नहीं करते, बिकॉज सिस्टमैटिक रिव्यू, मेटा एनालिसिस, ये तो ऐसी चीजें हैं जो रिपीट उस वक्त तक नहीं होती जब तक आउटडेटेड ना हो जाए. फॉर एग्जाम्पल 10 साल पहले अगर कोई रिसर्च पब्लिश हुई है तो आप दोबारा उसको रिपीट कर सकते हो अगर अभी तक नहीं हुई है, लेकिन आपको चेक करना पड़ेगा कॉकरेन लाइब्रेरी में कि वेदर that particular review article has been conducted recently or not. Cochrane library is very important because that is specific to systematic reviews. Whenever you get an idea, you will have to go check with Cochrane library to see whether that particular topic has been published or not. And then you also have to go to Prospero to see whether that similar topic is being conducted or will be conducted in near future by some other team or not. Right? So that is one of the reasons why we actually register in Prospero, because we don't want to duplicate systematic review. We don't want to duplicate meta-analysis. So we have PubMed, we have Cochrane library, then we have Scopus. Now Scopus might be a little bit of it might be difficult for everyone to get access to Scopus. So it's always important to have a multi-institutional collaborative team, so that one member of the team at least have access to Scopus, right? Now, Scopus, Ambase, Web of Science, they're all good sources of databases which you can use. If you have a specific topic that is related to a certain subject, then you can go directly search for the different journals. For example, AHA, AMA, BMJ, all of these journals are, high impact journals, and you can go search for your topic specifically in these journals directly as well. That would be called your manual searching for different journals, and you can do that as well to further make sure that you're not missing out on any evidence. The other thing that you can do is, if there's if there's if you're doing a topic that was conducted 10 years ago, and now you just want to update it, then what you can do is make sure that, firstly, make sure that there's no study that has been conducted, and then secondly, see what the previous meta-analysis or systematic review used, like for databases, whether they use PubMed, whether they use Cochrane, whether they use Scopus or something else, right? And then check out their search string as well. It's easier to do that actually as a student, when you're trying to update a systematic review, because that will save you a lot of time. You will not have to start from scratch. You will have your first study published, and now you will be, repeating it by making sure that the recent most evidence is put forth and published. The other thing that you can do is, you can use your, okay, PubMed, Cochrane, Scopus, Ambase, Web of Science, then use the keywords related to that you will develop a table. You will use your PICO's framework to make sure that you're including all the relevant words and keywords, and then develop your search string by using Boolean operators. Boolean or actually help you narrow down certain concepts in your search string, and they help you to broaden your search string. So when you're using different terms, that mean the same thing, you will use the word or. And when you're using two different concepts and you want to merge them together, you want to make sure that the database gives you the article which have both of these concepts, then you're going to use the and word. So the word and will narrow down your research, narrow down your search results, and when you're using or, it will help you broaden your search results. Is that clear? First years, second years, please let me know if you're able to, understand everything I'm saying.
Ma'am, I guess it is clear because people are giving the thumbs up reaction.
Okay, perfect. So this is an example that I have mentioned: type 2 diabetes, metformin, placebo, blood sugar levels, randomized controlled trials. These are the different PICO's criteria that I have mentioned: the intervention, the population, the comparator group, the outcome level, the study design. You can even throw in the study design that you're trying to explore. If it's just the randomized controlled trial, then you can specify your search string to randomized controlled trials. Okay, moving on.
Ma'am, there's a question.
Yeah.
Mohammed Mobazir is asking that, AO ma'am, I have a question. So, for example, I'm conducting a systematic review on a certain topic. So, should I consult a single database or multiple databases for literature search?
So according to the Prisma guidelines, you should have at least two databases. At least two databases. But if you see the published literature on different systematic review, you will see that most people actually prefer using 3 or 4 databases as well. But two is the minimum requirement. Okay. Now, moving on to establishing the inclusion and exclusion criteria, extremely important part of your systematic review. As I said, that systematic reviews and meta-analysis must have a predefined set of, inclusion and exclusion criteria. You need to make sure that you know which studies you want to include, which one you want to throw out. So like imagine if you have a box where you want to keep certain memories, and you want to exclude certain memories which upset you. You just throw them out of the box, right? So that's exactly what you're doing. You're trying to filter out the studies that are not relevant, and you want to make sure that you include the studies that are relevant to your question, right? So this is an example of inclusion and exclusion criteria. So an inclusion criteria would say studies published in the last 10 years, randomized control trials. All the studies that are published in English language will be included, but not the studies that are non-peer reviewed. Some now we have a culture of pre-printing, right? Preprint is what? Does anybody know what a preprint is? I honestly will give you a cookie if you tell me what a preprint is. I'm just kidding. I'm not gonna give you a cookie. Preprints are, nobody knows. Okay.
I guess people don't know this.
Okay, no problem. Now you would know. So we have a preprint culture nowadays. Now, what is a preprint culture? And it's not a bad thing. I'm not saying it's a bad thing. It's just we have a preprint culture. So when you do a research, it has to go a very rigorous process of peer review in a journal. It has to go through at least two experts, which make sure that your study is up to the mark and they can publish it in their journals. If they find flaws in your study, they can ask you to revise it or reject it outright, right? So peer review is extremely important, because when you conduct your study, you have to make it go through expert review, and they can let you know whether there's any major flaws in this study or not. And that's important, right? You cannot publish something that has major flaws in it, right? So when nowadays what's happening is that journals are actually asking you whether you want to go for a pre-printing service. Now pre-print means that the article will not undergo any peer review, but it will be published online. It will it will be published online. It is still under consideration for publication in journal, but meanwhile, while it is being peer reviewed by the journal, it will also be accessible to anyone in the community, and they can read your article. And this will just the purpose of a preprint is that before the peer review is completed, you can have the community check out your paper and see if they like it or don't like it, or they have any comments about it, and they can let you know that you should change this, you should do this, you should add that. They can even do that, right? And you should not cite a preprint article, because it has not as of now gone through peer review. Once it's published, it will give you a link to go to that published article. Because while the peer review is being conducted, they're also going to ask you to revise your article based on the things that they find that are flaws, that can be further improved. So once that article is refined, once that article is improved, only then the journal publishes it, and then only it should be referenced in your research paper. So make sure that preprints are not included in your systematic review. Now you know what a preprint is. It's a publication. It's not a publication. It's basically a access to your article, access to any study which has not undergone peer review and has been recently conducted. Okay, everyone clear on that?
Yes, ma'am. Ma'am, there's also another question in the chat box. Should I read it out right now or at the end?
Yeah. No, just go ahead. Read it out, please.
So Sara Ali Kiani is asking how old. Yes, ma'am. Sara Ali Kiani is asking that how old should a systematic review be for it to be eligible for an updated one, and minimum how many new RCTs are needed to conduct an updated one.
always have like at least 3 RCTs to conduct a meta-analysis. But for a systematic review, there's no such specific number of articles, because for systematic review, you are not going to have use a statistical software. But for a meta-analysis, it's not a necessity, it's as recommendation that you at least have 3 RCTs conducted, right? The other thing, the other question was that how old the previous meta should be to for us to conduct a new one is depends on the number of RCTs that have come up. If a lot of RCTs have come up now and the previous article did not include those, then you can conduct the new updated one as well. But mostly what happens is that um, articles, systematic reviews, if you want to repeat it, if you want to update it, it's usually like 10 years. The first one is usually 10 to 14 years older. That's what I have recently understood. But this is not set in stone, this is not a criteria that you cannot conduct it if it's like younger than 10 years, right? This is not a criteria, this is just something that depends on how many studies have come up since then. If there's a lot of studies and a lot of contrasting studies have come up since then you will be able to conduct a review on that again. You will update it even if it's like 3 years, 4 years, specifically those medicines, those studies that are actually just recently introduced. So more data, as more data accumulates, you can conduct a new meta analysis, new systematic review, definitely. All right, does that answer your question? Okay, let's move forward. So this is a prisma flow diagram, and prisma flow diagram is basically how I want to show you here how what the whole process looks like. So you can see that you start off with by in identifying certain number of studies from your databases and from different journals, and then you will remove it based on the pre-defined criteria. You will remove some of these papers, you will filter out some of the papers based on the predefined criteria. So for example, and also you will remove the duplicates, because you're using Scopus, you're using PubMed. A lot of journals are indexed in both of these, so there's bound to have duplicates, right? So you will remove the duplicates first, you will remove the articles that do not fit your eligibility criteria, and then you will remove for other reasons such as language barrier, perhaps access नहीं मिल रहा. अगर कोई आर्टिकल है जिसका एक्सेस ही नहीं मिल रहा लेकिन वो एलिजिबल है, तो आप उसको इंक्लूड नहीं कर सकते, क्योंकि आपको हमेशा फुल टेक्स्ट चाहिए होता है कभी भी कोई भी स्टडी सिस्टमेटिक रिव्यू में ऐड करने के लिए. ठीक है, फिर फाइनली आप अपने जो है ना स्टडी एट द एंड आप नंबर ऑफ स्टडी बताते हो कि इतनी स्टडीज हमने पहले निकाली थी डेटाबेसेस से और उसमें से इतनी रह गई. ठीक है, एंड देन क्यों निकाली थी, क्या रीजन था, वो सब आप यहाँ बराबर में डिफाइन करते हो कि क्या क्या रीजन था उनके निकालने का. ठीक है, this is how a prisma flow diagram would look like, and this would come at very end. Once actually it's a tip from my side that once you start your systematic review, once you start the screening, you should have a document which has all of these things written, like initially आपने कितने जो है पेपर्स शॉर्टलिस्ट किए थे, फिर आहिस्ता आहिस्ता वो कम होते 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 कितने रह गए और क्या क्या रीजन थे एक्सक्लूड करने के, वो एक जगह पे बना के रख लो. क्योंकि जब ये बाद में जब मैन्युस्क्रिप्ट बनाने पर आओगे ना, तब तुम लोग भूल जाओगे कि हमने कितने आर्टिकल्स निकाले थे. कभी कभार एक साल लग जाता है लोगों को एक प्रोजेक्ट कंप्लीट करने में, तो जब तक जो है ना और स्टडीज आ चुकी होती है, फिर जब आप अपना दोबारा से सर्च स्ट्रिंग डालते हो ना, तो वो जो नंबर्स होते हैं ना वो पूरे आउट हो जाते हैं. फिर उस वक्त आपको याद नहीं रहता कि उस वक्त मैंने कितने नंबर्स निकाले थे, कितने आर्टिकल्स निकाले थे. ठीक है, तो मेरी टिप ये है कि जब भी आप सिस्टमैटिक रिव्यू स्टार्ट करो तो आप अपने पास एक डॉक्यूमेंट रखो ऑनलाइन, और उसमें लिखते जाओ कि मैंने अभी गूगल स्कॉलर किया, अभी मैंने पबमेड किया, तो उसमें से इतने जो है ना रेलेवेंट नहीं, मतलब पहले दफा सर्च स्ट्रिंग डालने पे इतने आर्टिकल्स आए, और मैंने अब जो है उसको बिल्कुल एंड में जो है इतने आर्टिकल्स को रिमूव कर लिया, इतने मेरे पास डुप्लीकेट्स आए थे, इतने मैंने इस वजह से निकाल दिए, इतने मेरे लैंग्वेज का इशू आ रहा था. ठीक है, जो भी इशू आ रहा था, जो भी रीजन था, राइट इट डाउन एंड मेंशन द नंबर. ठीक है. You can make a table for it. You can make a table for it for different databases. PubMed का अलग बना लो और उसका अलग बना लो Scopus का. इस तरह तुम लोग ऑर्गेनाइज कर लोगे अपनी अपनी रिसर्च को बहुत अच्छी तरीके से. ठीक है. Okay.
Ma'am,
Now
there is
let's
another
come.
question.
Yeah.
Ma'am, Ishan
Go
Ahmed
on.
is Ma'am, Ishan Ahmed is asking that what is the minimum number of included studies for a viable systematic review?
There's no minimum number, but systematic review at least minimum number कैसे मैं बताऊं. मतलब I have never seen a systematic review with less than 5 studies. 5 studies तो होती हैं, 10 होती हैं मैक्सिमम. 2 नहीं हो सकती. 2 में आपने क्या करना है. 2 में कैसे आप खुद सोचो. अगर आप कोई क्वेश्चन डेफिनेटिव क्वेश्चन आंसर करना चाह रहे हो, क्या आप 2 स्टडीज में कर सकते हो. अगर एक स्टडी कुछ कह रही है, दूसरी स्टडी कुछ कह रही है, कैसे बताओगे कि क्या आंसर है उसका. इसका मतलब कि आपको एटलीस्ट 3 से 4 स्टडीज तो होनी चाहिए ना, जिस पे आप सिस्टमैटिक रिव्यू कंडक्ट कर सको. राइट. सो देयर इज नो मिनिमम नंबर. बट अगर आपके पास 10 है ना, तो ये बेस्ट नंबर है. मैं अभी सिस्टमैटिक रिव्यू कर रही हूँ, उसमें मेरे पास 130 स्टडीज है और वो मैं पिछले साल से कर रही हूँ. So there's no minimum number, there's no maximum number. It just depends on what is the question that you're trying to answer.
Ma'am, there's another question. Junaid Hassan is asking in reference. A few days ago, we had a workshop with Dr. Malik Muhammad Adir, and he mentioned that do not use pirated tools to acquire full text or articles. You might get blacklisted. So he's asking that should Pakistanis be concerned about this, i.e., using Sci-Hub?
I don't. Matlab, I use it, but I think this is more of a concern of people abroad. That's if that's what you're getting at. I don't think that you're gonna get blacklisted, but if you want access, like ethically, then you can go to your teachers. You can go to your colleagues who have the access to that database. Sometimes the institute would give them the access, and you can even request your librarian articles, right? Okay. I think that's more of a concern of people who are living abroad, because piracy is a major issue, and many journals don't like it that we use pirated. We don't have to actually accept that. First of all, we cannot accept that we use pirated websites to do that, because this is unethical. But if you really need that article and you don't have access, the best thing is to find someone who has access to the database. That's what I do. I ask my colleagues who are currently enrolled in some universities, and they have access to those journals and those databases, right? So I just ask them, just can you just send me the link to this, and at the end you can acknowledge their contribution. You can acknowledge them that they helped you get access to a few articles, right? That's totally ethical. That's fine. If they contributed intellectually as well, you can even add them as author, right? Does that make sense? There's an option actually in PubMed to get full text, like just filter out the full text. It often helps me make sure that I am not getting any articles which do not have full text, right? Full access. So I just use that filter, honestly, because I don't want to include a subscription based article which does not have any access, but it can be problematic in a research which is very rare, right? You might miss out on some very valuable data. For that, I would definitely want you to find someone who has access and then thank them by acknowledging their contribution. Okay. Now,
There's another question. Do you
I
want
think
that I?
yeah, I think let's wait because we are already 20 minutes into our extended time period, because I just want to finish this Prospero thing. Then we can have we can have questions. Okay.
Okay.
So what is Prospero? The seniors would already know that. Can some one of the seniors please explain what Prospero is and why do we use that?
सैयद सिप्ते हैदर, अगर आप हो तो आप बताओ इसके बारे में।
ओके, नो, मैं बता देती हूँ। चलो, बेसिकली प्रोस्पेरो एक डेटाबेस है जहाँ पे हम सिर्फ प्रोटोकॉल रजिस्टर करते हैं। प्रोटोकॉल क्या होता है? आपकी स्टडी का प्लान, आपके सिस्टमैटिक रिव्यू का प्लान, आपके मेटा एनालिसिस का प्लान। ठीक है, इट इज एक्चुअली स्पेसिफिक टू सिस्टमैटिक रिव्यू एंड मेटा एनालिसिस। ठीक है, इस तरह का दिखता है ये। आप प्रॉस्पेरो लिखोगे, आपको ये इंटरफेस दिखेगा। इसमें आपको अपना फ्री ऑफ कॉस्ट, देयर इज नो फ्री फी फॉर दिस रजिस्टरिंग इन दिस प्रोटोकॉल, सॉरी डेटाबेस। आपने अपना अकाउंट बनाना होगा इसमें, और आपने अपने जो है ना, जो भी आप रिसर्च आपने प्रोटोकॉल जिस पर्टिकुलर सिस्टमैटिक रिव्यू के लिए आपको रजिस्टर करना है, आप वो स्टार्ट कर सकते हो। ठीक है, the reason why we use Prospero is because we want to make sure that the scientific community know that we are conducting a systematic review or a meta on certain topic, and we will be finished by this date and all, and then they would know not to recreate it, like they would know not to duplicate it. अगर कोई और किसी और ने प्रोटोकॉल वहां पे ऑलरेडी पब्लिश किया हुआ है, तो हमें पता होगा कि हमें ये दोबारा नहीं करना, क्योंकि ऑलरेडी कोई कर रहा है उस पर। ठीक है, अगर वो नहीं करता उस टाइम पीरियड तक, फिर you can go ahead and do that, but until then, until the time they have identified for themselves the timeline that they have provided for themselves, you cannot conduct that. Like, you should not conduct that. Like, some unethical practice is that, some unethical practice is that कि वो भाई आपका प्रोटोकॉल देखते हैं, फिर भी वो अपना पब्लिश कर देते हैं और आपसे पहले कर देते हैं। तो जब भी कोई रिसर्च करने का इरादा करो, तो उसको कंडक्ट कर लो विद इन अ फ्यू मंथ्स, अदरवाइज समवन एल्स विल कंडक्ट इट, एंड देन ये बेसिकली स्टीलिंग ऑफ आइडियाज होता है, एंड यू कैन नॉट से एनीथिंग, बिकॉज मे बी दे वुड से कि भाई मैंने तो नहीं देखा था, मे बी मैंने आपका प्रोटोकॉल नहीं देखा था, हाउ वुड आई नो, एंड they are living in some other country, how will you even confront them, right? So it's always important not to just delay the process of systematic review or meta. If you have made a protocol, if you have registered it, then it needs to be conducted within 6 months of starting. Okay, so what you're gonna do is, you're gonna make sure that आपका जो Prospero की registration है, उसके लिए आपका प्रोटोकॉल एलिजिबल है या नहीं। ठीक है, उसकी एलिजिबिलिटी क्या है? सबसे पहले उसमें एक ना एक आउटकम होना चाहिए जो कि हेल्थ रिलेटेड आउटकम हो। एवरीबडी नोज के एवरीबडी नोज की जो हम सिस्टमेटिक रिव्यूज करते हैं वो हेल्थ रिलेटेड आउटकम्स के लिए करते हैं। मेटा एनालिसिस जो हम कर रहे होते हैं, हेल्थ रिलेटेड आउटकम्स के लिए कर रहे होते हैं। ठीक है, तो it needs to have a very clear outcome defined, like as I said that पेन इंटेंसिटी अगर कम हो रही है, ज्यादा हो रही है, तो ये क्या है? हेल्थ रिलेटेड आउटकम है। ठीक है, इसी तरह रिपोर्ट एटलीस्ट वन आउटकम। मैंने रिसर्च क्वेश्चन कर रहे हो तो उसमें मल्टीपल क्वेश्चंस हो सकते हैं, लेकिन एटलीस्ट एक होना जरूरी है। ठीक है, मस्ट नॉट हैव स्टार्टेड डेटा एक्सट्रैक्शन। आपने रजिस्ट्रेशन जो करनी है ना प्रोस्पेरो में, वो आपने करनी है प्रिलिमिनरी सर्च पर। प्रिलिमिनरी जब आपने सर्च कर लिया, आपने अपना वो फाइनलाइज कर लिया रिसर्च क्वेश्चन, उस वक्त आप स्टार्ट कर सकते हो प्रोस्पेरो की रजिस्ट्रेशन। लेकिन अगर आप भूल गए और आपने डेटा एक्सट्रैक्शन भी कर ली, अब आपको याद आ रहा है यार मैंने तो जो है ना वो प्रोस्पेरो पे रजिस्टर ही नहीं किया, फिर आप उस पॉइंट पे जो है ना डेटा एक्सट्रैक्शन के पॉइंट पर प्रोस्पेरो पे रजिस्टर नहीं कर सकते। ठीक है, और माइंड यू कि जर्नल्स विल आस्क यू कि आपका प्रोस्पेरो का रजिस्ट्रेशन नंबर क्या है। तो दिस इज वेरी इंपॉर्टेंट। ठीक है, यू हैव टू मेक श्योर कि यू आर रजिस्टरिंग इन प्रोस्पेरो, बिकॉज अच्छे जर्नल्स हमेशा आपसे पूछेंगे कि आपका प्रोस्पेरो का रजिस्ट्रेशन नंबर क्या है, और आप लोग सिस्टमैटिक रिव्यू तो आपको भी नजर आता होगा यार ये जो लिखा हुआ है ना ये नंबर क्या है, ये रजिस्ट्रेशन नंबर होता है, सी से शुरू होता है और वो नंबर होता है प्रॉस्पेरो का, ठीक है। अच्छा जी, अब उसमें क्या क्या आपसे पूछेंगे, एप्लीकेशन होगी ना पूरी एक, तो उसमें आपसे क्या क्या पूछेंगे। सबसे पहले वो आपसे आपका रिसर्च क्वेश्चन पूछेंगे, ठीक है, कि आपने रिसर्च क्वेश्चन बनाया है नहीं। तो ये चीजें हैं जो मैंने लिस्ट डाउन की हैं कि आपको पहले से पता हो बिफोर यू स्टार्ट रजिस्टरिंग योर प्रोटोकॉल, ठीक है। सबसे पहले तो आपका रिसर्च क्वेश्चन फाइनल होना चाहिए, आपका जो है प्रोटोकॉल डेवलप होना चाहिए। प्रोटोकॉल बेसिकली प्लान होता है कि आप कैसे कंडक्ट करोगे, क्या इंक्लूजन क्राइटेरिया होगा, क्या एक्सक्लूजन क्राइटेरिया होगा, एक्सट्रैक्शन कैसे करोगे, कौन करेगा एक्सट्रैक्शन, कितने लोग एक्सट्रैक्शन करेंगे, स्क्रीनिंग कौन करेगा, फिर उसको आउटकम्स को कौन रिफाइन करेगा, एनालिसिस कौन करेगा, ये सारी चीजें होती है प्लान आपका, ठीक है, प्री डिफाइंड प्लान होता है आपका, ठीक है। तो वो आपने पहले से बना के रफ डॉक्यूमेंट में बना के रखना है, ठीक है। फिर आपने जो है ना फंडिंग, अगर कोई फंडर है आपका, कोई फंड कर रहा है आपकी स्टडी को, तो आपने फंडिंग की डिटेल्स जो आपके पास होनी चाहिए, ठीक है। यूजुअली हम खुद अपने पैसों पे कर रहे होते हैं सब काम, तो हमें कोई फंड तो कर नहीं रहा होता यूजुअली स्टूडेंट्स को, तो हम लोग यहाँ पे लिखते हैं नो फंडिंग सिक्योर्ड, ठीक है, या नो फंडिंग नीडेड, या नो फंडिंग या नील लिख दो बस, सिंपल। पोटेंशियल कॉन्फ्लिक्ट्स ऑफ इंटरेस्ट, यहाँ पे यूजुअली हम नन डिक्लेयर्ड लिखते हैं, नन डिक्लेयर्ड, दैट्स इट। ये हो गया। अब आप स्टार्ट कर सकते हो अपनी रजिस्ट्रेशन। सबसे पहले आपने क्या करना है, आपने अपना अकाउंट क्रिएट करना है अपने नाम से, अपनी ईमेल से। फिर अपनी एक न्यू रजिस्ट्रेशन स्टार्ट करनी है। क्या रजिस्टर करना चाह रहे हो, सिस्टमैटिक रिव्यू रजिस्टर करना चाह रहे हो, ड्रॉप डाउन लिस्ट में आपको वो स्पेसिफाई करना होगा। फिर वो आपसे कुछ क्वेश्चंस पूछेंगे कि आपने कहाँ तक काम कर लिया है, कब तक आप खत्म कर लोगे, इस तरह के क्वेश्चंस पूछेंगे। फिर आपको सारी जो इन्फॉर्मेशन आपको ड्राफ्ट में रिव्यू करनी होगी और फिर आप इजीली सबमिट कर सकते हो। कुछ चीजें जो वो डिटेल में मांगते हैं, जैसे कि सबसे पहले तो वो आपसे बेसिक डिटेल्स मांगेंगे, आप हो कौन, आपकी टीम मेंबर्स कौन है, आपका रिव्यू क्वेश्चन क्या है, क्वेश्चन का बैकग्राउंड क्या है, किस मेथोडोलॉजी के तहत आप जो ये सारा काम कर रहे हो, ठीक है। मेथोडोलॉजी वही होती है जो मैंने अभी आप लोग को बताया कि सबसे पहले आपका वो आ जाता है कि भाई आपने आपका पी कोर्स क्राइटेरिया क्या था, आउटकम्स क्या थे। उसके बाद आप बताओगे कि भाई आपने कौन से डेटाबेसेस यूज किए, सोर्स ऑफ इंफॉर्मेशन क्या थी आपकी, ठीक है। उसके बाद आप बताओगे कि इसमें आपने सर्च टर्म्स कौन सी यूज की। नाउ एट दिस पॉइंट आई वांट यू टू अंडरस्टैंड दिस वन थिंग, that you don't want to explain everything in detail. You want to give Prospero the least amount of information. And इसका एक रीजन है, लाइक फॉर एग्जाम्पल अगर आप रिसर्च कर रहे हो वही जिसमें दूसरा बंदा भी इंटरेस्टेड है, तो वो आपका प्रोटोकॉल देख के कॉपी कर सकता है। देयर इज अ चांस ऑफ गेटिंग your protocol stolen from Prospero, right? So you can do one thing, you don't have to define the search string, optional होता है ये, Prospero भी आपसे mandatory नहीं मांगता, तो search string define नहीं करना। बाकी सारी चीजें आप दे सकते हो, search string में थोड़ा सा reserve रहना, you don't have to give them the exact terminologies that you're gonna use, just give them like 3 or 4 pointers, like कि मैं ये keywords use करूंगा, ठीक है। फिर आप उसको बताओगे कि एक्सट्रैक्शन कौन करेगा, स्क्रीनिंग कौन करेगा, अगर कोई डिसेंट आता है, अगर कोई दो रिव्यूअर्स हैं और वो कहते हैं कि यार नहीं ये आर्टिकल इंक्लूड होना चाहिए, ये दूसरा कह रहा है ये वाला आर्टिकल इंक्लूड नहीं होना चाहिए, तो आप उस तरह के डिसएग्रीमेंट में क्या करोगे, आप बताओगे उसको कि भाई अगर ऐसा कोई डिसएग्रीमेंट होता है तो वी विल आस्क द थर्ड सीनियर पर्सन टू मेक द डिसीजन फॉर अस, राइट, एंड कंसेंशुअल डिसीजन होगा, ठीक है। एंड देन फाइनली आप जो एक्सट्रैक्शन पे आओगे तो क्या क्या चीजें एक्सट्रैक्ट करोगे, आप एक पेपर है आपके पास, तो उस पेपर में से आप क्या क्या चीजें निकालोगे, कौन कौन से वेरिएबल्स निकालोगे, तो उसका आपके पास एक पूरी लिस्ट होनी चाहिए, ठीक है। तो कुछ चीजें आप प्रोस्पेरो में ऐड कर सकते हो, ठीक है। देन यू हैव योर डिसिमिनेशन प्लान, लाइक आप डिसिमिनेट कैसे करोगे, डिसिमिनेशन क्यों जरूरी है किसी भी रिसर्च के लिए। आपने रिसर्च कर ली, अगर आप रिसर्च लेके बैठ जाओगे घर पे तो साइंटिफिक कम्युनिटी को क्या फायदा होगा इसका, उनको तो नहीं पता चलेगा कि आपकी स्टडी का रिजल्ट क्या था। तो आपने डिसिमिनेट इसलिए करना है क्योंकि आपको अपने रिजल्ट फाइंडिंग्स को साइंटिफिक कम्युनिटी तक लेके जाना है, क्लिनिशियंस तक लेके जाना है, एकेडमिशियन तक लेके जाना है, रिसर्चर्स तक लेके जाना है, ठीक है। तो इस वजह से इट्स इंपॉर्टेंट दैट वी पब्लिश आवर रिसर्च। इसी वजह से हम इतनी मेहनत करते कि हम अपनी स्टडी को पब्लिश करें और साइंटिफिक कंट्रीब्यूशन करें, ठीक है। कुछ चीजों में वो एज आई सेड दैट थोड़ा डिटेल में मांगते हैं, प्रोस्पेरो थोड़ा डिटेल में मांगता है कि भाई आप रिव्यू क्वेश्चन का पीकोस क्राइटेरिया बताओ, फिर वो कहता है कि डेटाबेस कौन कौन से यूज करोगे, इंक्लूजन और एक्सक्लूजन क्राइटेरिया क्या है आपका, ठीक है, एनालिसिस अगर करना है तो कैसे करोगे, ठीक है, किस सॉफ्टवेयर पे करोगे। आई थिंक अब अभी हमारे पास सिमुलेशन का टाइम तो नहीं है, लेकिन मैं आप लोगों को असाइनमेंट जरूर दे सकती हूँ, आप लोग वो जरूर करना। फिर हम उसको कभी और मौका मिला तो मैं वीडियो सेंड कर दूंगी। ओके, सो दिस इज व्हाट अ प्रोस्पेरो लुक्स लाइक। दिखा देती हूँ, आई थिंक इट्स बेटर टू जस्ट शो इट राइट नाउ। यू आर एबल टू सी माई स्क्रीन? ये चल क्यों नहीं रहा? अच्छा, अब मेरा अकाउंट ऑलरेडी बना हुआ है यहाँ पे, तो मैं वही दिखा रही हूँ आप लोगों को कि मेरा अकाउंट कैसा दिखता है, ठीक है। आपने लॉगिन किया, लॉगिन करके आप माय प्रोस्पेरो पे चले गए या सर्च कर लिया। सर्च करना क्यों जरूरी है कोई भी चीज? क्योंकि आपको देखना है ना कि अगर आप कोई सिस्टमैटिक रिव्यू स्टार्ट कर रहे हो तो कहीं प्रोटोकॉल कर सकते हो, आप कैसे उसको डिफरेंट बना सकते हो, ठीक है। अच्छा, तो दिस इज हाउ माय रिकॉर्ड्स वुड लुक लाइक। दिस इज माय डिफरेंट सिस्टमैटिक रिव्यूज एंड मेटा एनालिसिस जो मैंने यहाँ पे रजिस्टर किए हुए, ठीक है। इसमें से जो है कुछ मेरे पब्लिश हो गए, कुछ अभी मेरे जो है इन प्रोसेस है, ठीक है। सो इफ आई क्लिक दिस, इफ आई वांट यू गाइस टू सी दिस, ये देखो रिव्यू टाइटल आया, फिर आपका जो है एंटिसिपेटेड या एक्चुअल डेट आ गई, ठीक है। फिर आपका जो कंप्लीशन डेट है वो आ गई, कौन सा है? ये सिस्टमैटिक रिव्यू, ये प्रिविलेंस, ये मेरा अभी खत्म हुआ, ये मैंने अभी सबमिट किया। और मैंने वहां पे एंटिसिपेटेड डेट लिखी हुई थी अगस्त 2023, नहीं, हाँ, अगस्त 2023। और अभी क्या हो रहा है? सितंबर 2024। तो ऑलमोस्ट आई एम लाइक 1 year late in submitting this. You can imagine the time it takes to actually do a systematic review. And then stage of review at time of this submission. तो उस वक्त मैंने start ही नहीं किया था, तो मैंने लिख दिया था preliminary searches. ये options होते हैं different that you can choose. प्रोवाइड एनी अदर रेलेवेंट इन्फॉर्मेशन, कुछ भी जरूरत नहीं है। नेम कॉन्टैक्ट, कौन कौन है आपके साथ वो आपने ऐड कर दिया। अगर आप इस पॉइंट पर एक बंदा भी ऐड कर लो ना, अपना मतलब अपना ही नाम ऐड कर लो, तो इट्स फाइन, इट्स नॉट मतलब ये आप बाद में जाके चेंज कर सकते हो। फिर आपका कॉन्टैक्ट एड्रेस आ गया, आपका फोन नंबर आ गया, फिर आप किस ऑर्गेनाइजेशन से एफिलिएटेड हो उस वक्त, फिर वो आ गया, फिर ऑर्गेनाइजेशन का वेब एड्रेस, ये सब आपने दे दिया। उसके बाद आपने अपने मेंबर्स को ऐड कर लिया, ठीक है। इफ यू वांट टू ऐड देम यू कैन ऐड देम, लेटर ऑन यू कैन रिमूव और एडिट देम। फंडिंग सोर्सेज स्पॉन्सर्स वो नॉट एप्लीकेबल था, मेरे पास कोई फंडिंग नहीं थी इस पॉइंट पर, तो मैंने नॉट एप्लीकेबल लिख दिया। अगर होती तो मैं वहां पे फंडिंग डिटेल्स लिखती और फिर ग्रांट नंबर भी मुझे लिखना पड़ता, ठीक है। तो वो नॉट एप्लीकेबल था, तो मैंने नॉट एप्लीकेबल लिख दिया। यहाँ पे कॉन्फ्लिक्ट्स ऑफ इंटरेस्ट एज आई सेड आपने नन डिक्लेयर्ड करना है। कोलैबोरेटर्स आपके कोई है नहीं, तो आपने आगे फर्दर रिव्यू क्वेश्चन पे चले जाना है, ठीक है। रिव्यू क्वेश्चन मेरा ये था, ठीक है, ये रिव्यू क्वेश्चन आ गया। अब मेरे मल्टीपल रिव्यू क्वेश्चन थे उस पॉइंट पर, तो मैंने यहाँ पे मल्टीपल रिव्यू क्वेश्चंस लिख दिए। फिर हमारी सर्चेस, मैंने कहाँ कहाँ सर्च किया, कौन कौन से, क्योंकि मेरा साइकाइट्री से रिलेटेड था ना, तो मैंने यहाँ पे साइकाइट्री के डेटाबेसेस भी स्पेसिफाई किए, ठीक है। फिर हमने जो है कहाँ कहाँ कौन कौन से डेटाबेसेस यूज किए, मैंने ये ऐड कर दिया। फिर इंक्लूजन क्राइटेरिया क्या था, लैंग्वेज रिस्ट्रिक्शन थी, पब्लिकेशन डेट रिस्ट्रिक्शन थी या नहीं, वो ऐड कर दिया। स्टडी टाइप्स मैंने कौन कौन सी ऐड करी हैं, मैंने वो भी ऐड कर दिया, क्योंकि मेरी स्टडी प्रिवलेंस पर थी। तो प्रिवलेंस का मतलब है कि मैंने ऑब्जर्वेशनल स्टडी सारी इंक्लूड करनी है, जिसमें हमारी कोहेड स्टडी, केस कंट्रोल, क्रॉस सेक्शनल सब आ जाता है, ठीक है। उसके बाद हमने URL टू सर्च स्ट्रेटेजी, यहाँ पे मैं नहीं देती हूँ क्योंकि ऑप्शनल होता है और इससे जो है ना आपके थोड़ी सी सीक्रेसी रहती है, ठीक है। तो इट्स बेटर नॉट टू गिव सर्च स्ट्रेटेजी इन डिटेल। ठीक है। उसके बाद आपने कंडीशन और डोमेन बीइंग स्टडीड। अब यहाँ पे आपने डिटेल में बताना है कि आपने क्या स्पेसिफिकली स्टडी का वो करना है। मेरे ख्याल से ये हमारा ना कहीं दूसरे मेटा का कॉपी हो गया, तो आपने सिर्फ ये बताना है कि आपके आउटकम्स क्या हैं। हाँ, मेरे ख्याल से ये वही पीकोस क्राइटेरिया है। पीकोस क्राइटेरिया पूरा आएगा अभी, पार्टिसिपेंट्स, इंटरवेंशन या एक्सपोजर, फिर आपका आ जाएगा कंपैरेटर, कंपैरेटर ग्रुप क्या है, तो उसके बाद फिर आपका आ जाएगा कि टाइप्स ऑफ स्टडी आप कौन सी इंक्लूड करें। तो पीकोस क्राइटेरिया आपने डिटेल में लिखना है, ठीक है। फिर कॉन्टेक्स्ट इज ऑप्शनल, जरूरत नहीं है इसकी। मेन आउटकम्स, अगेन मेन आउटकम्स आपने लिखना है। फिर मेजर ऑफ इफेक्ट, कि आप अगर एनालिसिस कर रहे हो तो एनालिसिस का आपने बताना है कि स्पेसिफिकली क्या मेजर ऑफ इफेक्ट है, क्या रिलेटिव रिस्क देख रहे हो, ऑड्स रेशो देख रहे हो, या कोई और चीज देख रहे हो, ठीक है। एडिशनल आउटकम्स, अगर आपके कोई एडिशनल आउटकम्स है तो वो बताने हैं आपने। फिर डेटा एक्सट्रैक्ट कैसे करना है। सो दिस इज अ वेरी डिटेल्ड application and it will take you a week to complete this, but take your time through this, like make sure that you have a predefined protocol। आपने ये एक दफा बना लिया तो आपके आगे के जो स्टेप्स होंगे वो इजी हो जाएंगे, ठीक है। अच्छा, एक चीज होती है जो हमें टाइम नहीं मिल रहा है, इस उसमें हमारा टॉपिक भी नहीं था। एक चीज होती है रिस्क ऑफ बायस। अब मैंने कहा कि ना हमें क्वालिटी क्वालिटी देखनी होती है कि हम एविडेंस जो दे रहे हैं सिस्टमैटिक रिव्यू में, आखिर वो किस क्वालिटी का है। तो उस क्वालिटी को असेस करने के लिए हम एक चेकलिस्ट फिल करते हैं, और वो चेकलिस्ट जो है ना हमें बताती है कि हमारे जो हमने अपने स्टडी के हमारे सिस्टमैटिक रिव्यू के अंदर हमने स्टडीज इंक्लूड की हैं, क्या वो हाई क्वालिटी की है भी या नहीं। अगर वो हाई क्वालिटी की नहीं है तो इसका मतलब है कि जो हमारा सिस्टमैटिक रिव्यू है उसका जो आंसर आया है वो इतना स्ट्रॉन्ग नहीं है, ठीक है, डेफिनेटिव नहीं है ये। इसका मतलब है कि हमें और मजीद हाई क्वालिटी की स्टडीज करने की जरूरत है, राइट। लेकिन अगर मैं असेस करती हूँ अपनी क्वालिटी हाई क्वालिटी, और मैं मेक श्योर करती हूँ कि मैं सिर्फ वही स्टडीज इंक्लूड करूँ जो हाई क्वालिटी की हैं, तो उसके बाद जो मेरा आंसर आएगा वो डेफिनेटिव होगा, ठीक है। तो ये कहलाता है रिस्क ऑफ बायस। क्वालिटी असेसमेंट भी कहलाता है। हम जितनी भी स्टडीज इंक्लूड करते हैं उन सबको हम एक चेकलिस्ट के जरिए असेस करते हैं, क्रिटिकली देखते हैं कि स्टडी के अंदर कितने फ्लॉज हैं, फ्लॉज नहीं है, क्या रैंडमाइजेशन हुई थी या नहीं हुई थी, या पेशेंट रिक्रूटमेंट कैसे की गई थी, ठीक है। ये सारी चीजें हम जब देखते हैं ना तो हम क्वालिटी का अंदाजा लगा रहे होते हैं किसी भी पेपर के, ठीक है। ब्लाइंडिंग जो हम करते हैं, ब्लाइंडिंग करने का मकसद क्या होता है कि बायस जो है ना वो कम कर सके, ठीक है। सैंपल साइज कितना था, ये सारी चीजें हमें बताती हैं कि हमारी स्टडी की क्वालिटी कैसी है, ठीक है। उसके लिए डिफरेंट टूल्स होते हैं, अगर जिंदगी रही तो हम कभी वर्कशॉप कर लेंगे उस पर भी। स्ट्रेटेजी क्या है आपके डेटा सिंथेसिस की। अब आपने अपना सिस्टमैटिक रिव्यू कंडक्ट कर लिया है, स्क्रीनिंग कर लिया है, अब आप एक्सट्रैक्शन में क्या करोगे, कौन से किस तरह आप एनालिसिस करोगे। अगर मेटा एनालिसिस है तो उसमें आपको बताना होता है कि आप कौन सा सॉफ्टवेयर यूज करोगे, फिर आप उसमें किस तरह जो है ना डेटा को ऐड करोगे। और एक और चीज होती है हेट्रोजेनिटी, कि एक स्टडी दूसरी स्टडी से कितनी डिफरेंट है, ठीक है। तो हेट्रोजेनिटी का इम्पोर्टेंस ये होती है कि अगर एक स्टडी बिल्कुल ही डिफरेंट है दूसरी स्टडी से, तो फिर आप कंपेयर कैसे कर रहे हो, दोनों स्टडी को एड अप कैसे कर रहे हो, राइट। सो हेट्रोजेनिटी इज अ वेरी इंपॉर्टेंट कॉन्सेप्ट, एंड एज आई सेड दैट अभी तो नहीं हमारा ये टॉपिक था, अभी तो हमें सिर्फ इंट्रोड्यूस करवाना था सिस्टमैटिक रिव्यू एंड मेटा एनालिसिस। लेकिन आगे फ्यूचर में अगर आप लोग कोई कंडक्ट करते हो स्टडीज तो हम इस तरह के जो मेन सिस्टमैटिक रिव्यू के हम इनको एक्सप्लोर कर सकते हैं, राइट। देन वी हैव एनालिसिस ऑफ सब ग्रुप्स। अगर कोई सब ग्रुप एनालिसिस कर रहे हो, जैसे फॉर एग्जांपल समवन सेड दैट जेंडर वाइज अगर हमने कैटेगराइज करना है तो वो सब ग्रुप एनालिसिस होगा। तो आपको मेंशन करना होगा कि हम अपनी स्टडी में ओवरऑल रिजल्ट भी प्रेजेंट करेंगे और फिर हम जेंडर वाइज डिस्ट्रीब्यूशन भी करेंगे, ठीक है। और फिर हमारा टाइप एंड मेथड ऑफ रिव्यू क्या होगा। एपिडेमियोलॉजिकल, यूजली इट्स सिस्टमैटिक रिव्यू। डिफरेंट टाइप्स होते हैं ना कि हमारे डिपेंड करता है कि हमारा आउटकम क्या है, ठीक है। तो यू यूजली गो फॉर सिस्टमैटिक रिव्यू, and if you are looking for a outcome that is related to prognosis, then you take take a prognostic as well. And if it's just a meta analysis, you take that as well. And epidemiological, if you're talking about a prevalence, if you're talking about frequency, then you are gonna go for epidemiological. एंड द हेल्थ एरिया, आपका कौन सा एरिया था जो इसमें एक्सप्लोर किया जा रहा था, वो भी आप ऐड कर सकते हो। एक से ज्यादा एरिया भी एक्सप्लोर कर सकते हो अगर आपका मल्टीपल उसमें जा रहा है, सर्जरी और वुंड्स वगैरह, यू नो। लैंग्वेज आपकी कौन सा लैंग्वेज यूज कर रहे हो, इंग्लिश होती है, हम यूजली इंग्लिश करते हैं, कौन सी कंट्री, यहाँ पे डिटेल्स आ गई। बाकी सारी चीजें ऑप्शनल हैं, डोंट go for that. And do not make this file publicly available until the review is complete. This is very important. Again, as I said, that people can steal your ideas, so it's important to make sure that you click this. Do not make this file publicly available until the review is complete. Now, they when you register it, they would know कि आप इस पे स्टडी कर रहे हो, अदर पीपल कैन सी कि आपका ये टाइटल है और आप इस पे स्टडी कर रहे हो। लेकिन आपका जो प्रोटोकॉल है ना, वो उनको नहीं दिखेगा। जो फाइल आपने पूरी अभी सबमिट कर रहे हो ना, वो फाइल उनको नहीं दिखेगी जब तक आप ये नहीं कह दोगे कि मैंने ये रिव्यू कंप्लीट कर लिया, अब आप इसको बेशक पब्लिश कर दो, ठीक है। So this is very important. And then dissemination plans. Obviously, do you intend to publish the review on completion? तो इसका आंसर होना चाहिए yes. अभी पता नहीं for some reason no हुआ है, but it should be yes. And give brief details of plans. ये भी optional है, इसमें भी details देने की जरूरत नहीं है. Current review status ongoing है, जाहिर सी बात है. Any addition? No. Details of final report and publication or preprints available. आपने यहाँ पे अगर आपने बाद में पब्लिश कर दिया है तो आप यहाँ पे ऐड कर सकते हो, ताकि जो भी आपका प्रोटोकॉल देखे वो आपका लिंक क्लिक करके आपके आर्टिकल पे चला जाए। दैट्स इट। आई नो ये थोड़ा सा व्हाट डू यू से दैट इट वाज एक्चुअली क्वाइट एक्सटेंसिव, बट दिस इज व्हाट इट इज। प्रोस्पेरो की रजिस्ट्रेशन अंडर मेंटोरशिप करना, make sure that you have a mentor, you have a supervisor, because I have seen that kids start off with very enthusiastically, and then they get stuck later on कि यार अब मैं क्या करूं, अब मैंने स्क्रीन कैसे करना है, ये कैसे करना है, वो कैसे करना है, और एंड देन दे हेस्ट में ना हमेशा काम गलत होता है। हेस्ट में आप गलत काम कर देते हो, और वो अगर कहीं एक्सेप्ट हो जाता है, किसी कॉन्फ्रेंस में एक्सेप्ट हो जाता है फॉर एग्जाम्पल, दैट्स गोइंग टू बी वेरी स्केरी, बिकॉज अगर आप गलत चीज कहीं प्रेजेंट कर दो तो imagine the impact it will have on your career. So I beg you guys to make sure that you have a supervisor on board. You have such a facilitative professors in your universities. Make sure that you take one of them on board who are experts in the field. Okay. The other thing that I would like to give you right now is the assignment, right? So अभी मैं assignment दे देती हूँ, फिर आप लोग क्या करोगे, आप लोग मुझे इसके Abdullah, will you make sure that everybody completes these assignments and then I can review them and give them feedback?
Yes.
Is that okay? Is that doable?
Yeah, yes, ma'am. We'll
Okay.
divide them in groups and then we'll make sure that they complete it. Or even if they can do it
Yeah.
individually, we'll give them individually.
Yeah. It can be done individually, but how many of you are there? मतलब ज़्यादा तो नहीं हो, कितने हो?
Ma'am, they are around 43.
हाँ तो ग्रुप कर लेना प्लीज। 43 असाइनमेंट्स कैसे करूंगी मैं?
Okay, ma'am. Okay, ma'am,
ठीक
you
है,
can give us a number of assignments that you can manage.
just one.
Then we
Yeah, oh, okay. Well, I think अगर 43 हैं तो उस हिसाब से अगर 4 ग्रुप्स में डिवाइड करो तो 10 करके 10 ग्रुप्स हो जाएंगे। लेट मी जस्ट सी असाइनमेंट में क्या क्या करना है। असाइनमेंट में बेसिकली आप लोगों ने डेवलप करना है रिसर्च क्वेश्चन और सर्च स्ट्रेटेजी। और एक्चुअली यू नो व्हाट, आप एक काम करो, इसको 3 का ग्रुप बनाना ज्यादा से ज्यादा। आई डोंट वांट के, बिकॉज दिस इज नॉट अ वेरी एडवांस assignment. This is a basic assignment for introductory class, right? मैं send करती हूँ। Abdullah, do I need? Can I just send it to you on WhatsApp? Then you can share it with them.
Oh, yes, ma'am. Yes, ma'am.
Okay, Abdullah, I
Ma'am, we
don't
have
have
made a
your number.
WhatsApp. Ma'am, I'll email you.
Okay, चलो ठीक है, email पे कर लेते हैं contact. ठीक है। Oh, so guys, do you have any questions for me at this point?
Ma'am, there are many questions. Like one of them is asking Ma'am, your way of teaching is quite impressive. Is there any way to learn and do systematic review under your supervision? And if you can share your Gmail, please. And a lot of participants were asking for your presentation slides also.
Okay, okay. So thank you so much that you guys liked it. And if you have, if you have interest in collaborating with me, I do have a very pretty busy year because I'm going for Umrah in October, and then I'm going to Mexico in November for presenting my papers. So I'll see how much I can be a part of your project. But definitely, if you have any, guide, if you want someone to guide you through it, then please do contact me. I will definitely try to be available as much as possible. Okay.
So,
My
ma'am,
email
we'll share
ID.
your email with them
Yeah, you
at the
can
end of
you
this.
can you can share my email ID with them, and the slides, I will share the slide summary with you as well, so that you can share it with them, and the assignment as well. Okay. And also, yeah, guys,
Okay.
one more thing. You will have to fill out your post course assessment, and also the teacher's evaluation as well. That's very important. Okay.
Sure, ma'am. We'll share both of these with the participants in the group.
All right, perfect. Thank you so much, Abdullah, for arranging all of this and moderating throughout. And thank you so much, Reads Society, for bringing me in. If you have further events like this, I would love to help your students out. The other thing that I would like to state is that the support that you guys are getting from the Department of Community Medicine and Dr. Sajila, that's very impressive. And the I also love the content that you guys are creating on YouTube. It's so interesting. I always, go to Instagram and check out your posts. So it's very interesting. Good job.
Yes, ma'am. Thank you so much, ma'am. It was such an honor listening to you, and I'm so happy for the first years that they got to learn about systematic review from you, because first time that I heard about systematic reviews was at the end of second year, at the start of third year, and I remember paying a very heavy amount just to know these basics that you so easily and eloquently just taught them. I hope that. They understand that it was a privilege to listen to these things for free, and we'll be looking forward
Yeah.
for a part 2 of this workshop, because the participants are also we'll try to develop a mentorship program with you for systematic reviews and meta-analysis, and we can have a series maybe in the coming months at your convenience. So it will be an honor for us
Perfect.
to collaborate with you on this topic.
Likewise. Thank you so much for having me. Allah Hafiz. I'm signing out.
Allah Hafiz, ma'am.